Welcome back to Office Hours. If you are confused about your weight, if you have questions about weight medicine, and if you want medically based answers to your weight questions, I can help you. My name is Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So welcome. Today is another fabulous rendition of Office Hours because you guys have sent in your fabulous questions. So I always love answering your questions. I love hearing from you. Please, if you have questions after this, leave it in the comment section down below or on any of the other videos. If you're watching, you have questions, I'll find the comments and I'll add them to the next one. So you know what? As a caveat, I can't answer personal medical questions. But if your question leans a little personal, I'm going to kind of change it a little bit to make it a little more broader and more educationally applicable to everybody. Does Mounjaro build up in your system after a couple of months? If someone's on a medium dose, do they typically stay on that medium dose or do they go up? Okay, that is a great question. So basically, any of the injectable medications, they don't work immediately. They have a half-life, I'll leave it down below, but it's gonna take several weeks for it to fully clear your system. So they do build up over time. It's kind of like when we go up on the dose of Tirzepatide, semaglutide, liraglutide, or any of the brand names for those medications. When we go up on the dose, it's like a light switch dimmer, like you're slowly turning up the light, and your goal, usually, unless someone loses a lot of weight early on, you might overshoot the mark. Your goal is to get to the highest level of light, the brightest light. But if you go up all the way fast, you're going to have a reaction. Like your body, it's like you blasted your body with like a bright white light first thing in the morning. That's very uncomfortable. That's kind of like what would happen to your body. It's an analogy of what would happen if you jumped right to the maximum dose. It would be a real shock to your body. It would be extremely unpleasant. You would have really significant side effects and it would be very uncomfortable, and I would not recommend that to anybody. So yes, it does build up in your body over time. It's not like one dose lasts forever, but you're just gradually building up the doses. You're gradually increasing the concentration over time like you would that kind of dimmer switch. So you go off of the medication, your body eventually it clears your system, so it doesn't hang around anymore. It doesn't last forever. So you have to stay on it for the effects to keep happening. If anybody's on a medium dose, if I had a patient who was on a medium dose and they were doing well, I would, every month, usually you bump it up to the next dose. If this is Tirzepatide, so I would keep bumping them up after every fourth dose, provided that there's no insurance issues or supply issues. So we're just going to keep going up if they're not having any issues until they get to the 15 milligram dose. Great question. Next question. You reference giving the injection in places other than the stomach. My question is this: can you inject into the front of the thigh as Eli Lilly says it's okay if you don't seem to have a lot of fat on the front of your thighs? Thank you. This is another good question. Yes, you can inject back of the arm. You can inject front of the thighs. You can inject abdomen. The needle is not extremely long, so you're probably not going to hit muscle. I just think, if there's any wiggle room, like if you're not sure, if you think, oh, actually, I really don't have a lot of subcutaneous fat in my thigh or my upper arm, like that's not really where I have more of that subcutaneous fatty tissue. You could err on the safe side and just rotate the site around your abdomen, as always, staying away from the belly button. But I think that's a really easy way to just make sure you're definitely getting it into the subcutaneous tissue, because the way the medication is absorbed into the body is going to be different if you are injecting it into the subcutaneous tissue as intended versus the muscle. So are you probably going to hit muscle? No, but I guess you can't be 100% sure. So if there's any question of that, or let's say you've been injecting it into your thigh and you're just not noticing any difference, that's when I would try some injecting on the abdomen to see if you notice a stronger effect, because I definitely have patients that they do notice a stronger effect, and I have patients that could inject in any of those places and it all works the same for them. So for anybody, it's really trial and error, but if you're not noticing an effect, you could try that. You could try the abdomen. Excellent question. This is a question about insomnia on a low dose of tirzepatide, or Mounjaro, and if that is common. So I have not, in the clinic, that is not something that I hear about. I don't know if I've ever had a patient, and I prescribe this a lot. I don't know if I've ever had a patient say, I started this medication and I had trouble sleeping. But a couple of you have said you do. And what's important to note is that people aren't textbooks. So for any medication, there's a list of the, predicted side effects, the known side effects, but human beings are not the instruction manual. We are not textbooks. And so there are going to be some people who have side effects that, we maybe haven't really heard about as much. So there certainly are some people who do have insomnia with tirzepatide. I'm sure there are people who have it with semaglutide. So uncommon, but not entirely outside the realm of what is expected. What I normally hear about is people have fatigue, so they are more tired, the day or two after their injection, or they just have kind of like a low level of fatigue. I hear about that a lot. Also, in many ways, these medications should help somebody sleep get better, because they are decreasing your risk of sleep apnea. They're decreasing your appetite for alcohol, which can interfere with your sleep. And they are decreasing, your desire to have large portions of food. So if you had that late at night, that could definitely interrupt your sleep. Normally, going to bed on a very full stomach can be very uncomfortable. So these medications help with those things. So in many ways, it can improve sleep or can make people feel tired. But every once in a while, somebody's going to have the opposite effect. So is it, completely unheard of or unthinkable that somebody would have insomnia? No. Do I hear about it a lot? No, but it could certainly happen. So if it's happening for you, you also just want to check in with your physician, make sure, are there any medications that could be, because these medications can interfere with the absorption of some medications in the stomach. Is there anything that could be interacting that I'm already on? Anything else that I'm taking that, because I'm now taking semaglutide or tirzepatide or liraglutide, because I'm taking that now, is there anything else that could be interfering with that in terms of my other medications? And then again, if people are feeling fatigued, that could interfere with your sleep cycle in general. So you might want to look into that, check in with your physician. There's labs you want to check if you have insomnia always. So good luck. It might go away. Sometimes these side effects just go away with time as your body gets used to them. But definitely within the realm of possibility, and but hopefully not a long-standing side effect for people. Next question, have you ever heard that a person was on Ozempic but they never lost 1 pound? I'm afraid of being that person. Oh my gosh, that is a great question. Everybody's lands somewhere on the bell curve in terms of their response. So there's certainly the average weight loss for Ozempic, which is going to be about, 12 to 15% total body weight. That's for people who are overweight or have obesity, but not diabetes. And then there are going to be the people who start it and they lose a lot more on a lower dose, or they lose a lot more on the highest dose. But either way, they're losing more than we would expect on the typical doses of Ozempic. And then there are going to be people who lose a lot less. Either they don't lose anything the whole time, or they get to the end, they get to the highest dose, and they really haven't really lost much, if at all. So there are people that don't lose a lot of weight on Ozempic. I will say that usually if people aren't losing weight on Ozempic, it's harder for people to lose weight who have diabetes. We know that. And also, there are certainly medications that can really interact with your weight loss medication. So if someone has diabetes, but they also have significant neuropathy and they are on high dose gabapentin or high dose pregabalin, those medications are going to fight the effect of the Ozempic. If somebody is on a high dose nortriptyline or amitriptyline, I've made a bunch of videos on things that can interfere with your the effects of your weight loss medication. So go through your list of medications with your physician and see if there's anything that could be interfering and if there's any wiggle room there. Maybe you decide you want to try going down on a dose. Maybe you decide you want to, opt out of that medication and see what happens. That's a conversation between you and your physician, but see what your options are. And then certainly there are going to be the people that they don't have diabetes, but they're on semaglutide. They don't have any medications that are interfering, or conditions like PCOS or hypothyroidism, or any sort of untreated condition that's lurking below the surface that could be interfering with their weight. They don't have any of that. But there are going to be those people that just don't lose a lot of weight with these medications. That's pretty rare, but it is going to happen. And if that's that person, I would say don't give up, because just because you don't have a great effect with one medication, all things being equal, we have a lot of good options now. So let's say everything is available. If someone's not doing well on semaglutide, I've had patients that do better on liraglutide or Saxenda Victoza. I've had patients, clearly we know, given the choice, Tirzepatide is generally a more powerful medication. So if somebody's not doing well on semaglutide, Tirzepatide as Mounjaro or Zepbound can be a much better option for them. So, and then there's also the oral medication. So I would not focus on what's going to happen and what if. I would just focus on, getting the data. So for those patients, you want to think about if they're not losing weight, that's a good time to have a conversation about are they on the maximum dose? Are there labs that should be looked at? Are there other medications that they're on? And what are medication alternatives? Those are all things that would be good things to discuss with the physician that's prescribing your medication for you. So that's going to do it for today. Thank you so much for all your wonderful questions. As always, if you have questions afterwards, please leave them down below, like, subscribe, do all the things. If you want to work with me, you totally can. I'll leave that information down below, and please be well.